It really is amazing what has been happening in the last 4 years specifically. I want just to give you a little bit of the history of the May 1st events, which started in 2007, organized by LLU, and now contributes with several organizations. And we hope that as the May 1st events continue, more and more organizations come together to make this truly a multi-organizational event. The purpose really of this event was to galvanize stakeholders from all across the country to advocate for national certification, which we were able to launch in 2009. And this year, 2010, it's a really special year because it's the first year in which we can actually commemorate this great achievement. The whole purpose and mission of this annual event, which is to promote national certification and the importance of health equity for language minority patients, and for us to continue to lobby on a regular and consistent and persistent basis for increased reimbursement for language services. At this time, there are still, however, people that believe or think that there is no national certification for medical interpreters. And that's because it's a new initiative, and we really have to get the word out to every single hospital in every single state, to every single interpreter who might not know that national certification is already available to them. So let's change this misconception. Let's start getting the facts. Let's start getting as informed as we can, because this is a continuously changing field in which more languages will be added soon. And we need to just keep ourselves updated, but also keep informing our colleagues and ourselves of what is happening. And you are at the forefront just by being here. We know that you really want the latest information. And I also believe that by next year, we could actually have a huge increase between this year and next year of the number of people that know that national certification exists for medical interpreters. And I want us to here at this moment really make a commitment to ourselves and to our colleagues and to our profession that we will do what we can in every opportunity we have to talk about national certification and to ask, are you certified? Did you know medical interpreters can get certified? This is a huge change in our profession, because now we can say this is a profession that has a national credential. And as you know, in healthcare, every single person who works in a hospital setting or a healthcare or other medical setting, has a license, has some sort of certification, some sort of credential. And interpreters were really the only ones outside the state of Washington that really did not have a credential. So this is huge. And we need to actually embrace it by getting certified ourselves. So let's make this commitment together. National certification was launched with a lot of media attention. But how can we actually continue to keep this topic at the forefront of our discussions in different associations, at different meetings, at our hospital? Does your hospital have a way to have a venue so that somebody could come in and speak about national certification? Could you gather information and try to put a group together just to inform your colleagues about it? I mean, we can each do a lot. And the whole premise of this event is that each single individual interpreter makes a difference. The National Board of Certification for Medical Interpreters, the newly formed 501c3 nonprofit organization, oversees this process. And really is an independent organization, and the exams are administered by an independent testing, very well recognized company, and is available at hundreds of sites across the country. Check out, if you haven't had a chance to really go through and understand all the details about certification, go to the certifiedmedicalinterpreters.org website. You've been working really hard in the last 6 months since the launch on just getting all the details and initializing this process, which is a really complex process. And I want us to give them a round of applause, and for the national board members to stand up, those that are here, because they really should be commended for all the work they've been doing. I think I'll leave you with this. Such a robust credentialing program, which is the plan to have every single language and every dialect covered under the National Board, is really audacious. There is no certification program for translators or interpreters anywhere that I know that covers all languages and dialects. And the idea and the premise of the National Board is to have a multi-credential, multilingual program so that every patient, every provider, and every hospital and every interpreter can get credentialed in some way and also have a means for us to provide safe patient safety to every single patient. And that's really important. This is a strong commitment to minority languages. And while you might not see every single language at first, it is in the process. And we're a group of doers. We're a group of action and not talk. So it will happen, but it is a lot of work, and we need your help. We need subject matter experts in other languages. There's a lot of work still to be done, which the National Board will speak more about later. A lot of people also have been asking, well, does the Department of Health and Human Services recognize this? Does the Joint Commission recognize this? Only certifications that are recognized by them will be successful. Well, we can say that they already recognize the national certification that has been launched. We have a letter from the Department of Health and Human Services congratulating us for this work and also stating that it really is a big impact for language minority patients. The Joint Commission, in their letter to us, stated that they can't endorse any particular type of credential. All they do is inform their hospitals, as they're accrediting their hospitals, what certifications and licenses are available for the different health professions. So our job is to keep them informed of everything that's available regarding medical interpreting so that they can inform their individuals. So these are important things for us to know because there's so much information being given out there. And just the notion that we already have their perspective and their recognition on the work that we've done is really important. And now we just need to get the federal government to not only recognize this work, but really credit it and reimburse credentialed medical interpreters. So to end, I really believe that these events have really created a national advocacy movement that can only grow and strengthen. This is really just the beginning. And there's only one direction forward, which is the expansion and recognition of certified medical interpreters. I can also see in the horizon this becoming a stronger national advocacy movement and for us to bring other individuals to play with us and to really make a difference for language minority patients. So thank you so much for having me speak here.